Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kozuch. Welcome back to another episode of Patient Journey Pioneers. We're honored to host Tressa Springmann, Senior Vice President and Chief Information and Digital Officer at LifeBridge Health. An honor to have you with us today.
Liat, it's an honor to be here with you and with Hyro. I look forward to the conversation.
We have a lot to cover today, Tressa, but I'm going to start by having you share a brief outline of your journey in healthcare. Then you're going to tell us what your role entails today at LifeBridge Health and what you're most excited about.
Thanks, Liat. So I actually started out in the sciences, the hard sciences, not the computer sciences. I found myself, I guess, a year out of college where I'd gotten my degree in biochemistry, working in a basic science lab at Johns Hopkins, and I hated it. It was isolating. I was thrilled and challenged by the scientific process and method, but it was really clear to me that I had just invested 4 years of my life and education in the hardest thing that I could find to tackle. But I wasn't finding it personally rewarding. So I took that opportunity to probably do what many people have been encouraged to do early on, which was some informational interviewing. But of course, early on, I was just too arrogant to assume I didn't know what was exactly best for me. And during that process, I had some informational interviews with electronic data systems, EDS. And, I walked away with this understanding that what was a pretty new discipline of computer science was very analogous to scientific method and what we were doing more in the hard sciences space, but using this new technology to solve for problems that hadn't been solved before. And so I ended up getting a job with electronic data systems. I learned some systems engineering. I could really equivocate what I'd done in the hard sciences and in a protein chemistry lab with what we were trying to solve with code. And anyway, ultimately, I was just going down a computer science path with EDS when they identified a gap in their own workforce for supporting products that they had in healthcare. They had hospitals that were running an old patient accounting system by SMS, formerly Shared Medical Systems, formerly Siemens, etc. And actually, EDS had created their own clinical system, and this was a long time ago. And they needed people who understood healthcare and also computer science. And I would say that was where my journey began. I had my first hospital client as an account executive with EDS at Jersey Shore Medical Center. And since then, probably the last 25 years have merely been informed, Liat, by this combination of how do we continually improve information technology to inform better care in our healthcare systems. So I have found it to be a lovely blend of scientific method with new and emerging technologies. I would also say that I hope I can hang around long enough to tap into what I was doing with protein chemistry research to see how our personal or electronic health records can better satisfy very targeted therapeutics and more personalized journeys for the care of people in the community. So I don't know if I'll be around for that long enough, but at some point we've got to capitalize on the uniqueness of my and your human genome. And so then what? What can we do there? So at LifeBridge, as you mentioned, I'm the Chief Information and Digital Officer. Those are really just a kind of an amalgamation of titles. Many organizations solve for advancing their own strategy by a variety of different leaders. I think what I would hope the audience would understand is, I'm part of the executive team at LifeBridge Health, and as part of our strategy, my objective is to always bring technologies that are helping to liberate dollars, enable care, enhance quality, etc. So whether they're digital, i.e. in the hands of our consumers, or whether they're traditional information technology to better support our care providers or our workforce, really my objective as the executive at the table is to be suggesting, implementing, and supporting these enabling technologies. And as you know, the turn of technology is pretty rapid, and the types of technology that we employ differ. So I am on this kind of continually changing journey as to how to take those technologies once they become a little bit more than bleeding edge and help our organization how they can be employed to do a better job caring for the people we serve.
That brings me to so many questions to ask, such as what are the challenges that come along with pushing along digital innovation within an organization? But we'll get to that. How would you define the change from back then to today when it comes to the digital patient experience?
Absolutely. Well, back then there wasn't one. So, Liat, really, when I started out, automation was getting a bill out the door. It was really on the financial side. And one reason in America we fell behind, as like other countries, they were investing, when it was a single payer system and they weren't having to put all their money in how to get clean bills out the door and get reimbursed, they were using their technology dollars for early health records. We didn't have that. We started with really automating the financial end of our business. Probably the last 15 to 20 years, as you know, have all been about the integrated EMR, right? And we are just on that inflection point of having enough information stored in these electronic health records to do something meaningful, to change diagnostic outcomes, to guide people to better sites of care, to actually do something with that data to differentiate ourselves. Probably the last 2.5 years, and maybe not even that much, we finally are seeing the patient in the community as our customer. And we've got to entertain digital ways to engage them, because that's how they want to engage. If it's clinically appropriate, right? It's got to be clinically appropriate. I think, and I'll hop over it to talk about one of the barriers, which is, as you know, Liat, right now, we are serving, especially when we start talking about the spectrum of age and comfort with technology, as a healthcare organization, we've got to be omni-channel, and we've got to deliver the same set of services, whether someone's own preference for interaction is physical, telephonic, digital. And by the way, that needs to be influenced by also what's clinically appropriate. Just because you want to have something diagnosed without getting out of bed in the morning doesn't mean that what you have can be safely done in that manner. So we are learning a tremendous amount, but honestly, it's only been the last 2 years that most traditional healthcare systems have seen the patient as a digitally enabled participant in their care. One of the interesting elements here, and I know you're seeing it, is there's this thought that there's a lot of money to be had in low acuity care. And I don't disagree. That is clinically appropriate for a lot of digital involvement. And, what I'm excited about is we now have these non-traditional disruptors that have had a lot more ability to finance and fund better technologies than these nonprofit health systems that we've been in. And I mean, let's face it, Leah, when we've got to make a decision about a new transformative biomedical device that's going to make a difference for care over another IT system, I know that if the science proves out for that medical device, that's going to be the best thing for the community. And those are the types of trade-offs we're always having to make. I think that we've seen the pendulum swing in and out when non-traditional players have believed that they can make, big money off of healthcare. But, at the end game, there's a part of the healthcare spectrum that is kind of transactional. I need it to be convenient. This is just bothering me. I need something quick and convenient. all the way to, I don't care how old you are, if you're struggling with a chronic condition, a digital platform and a transactional relationship alone isn't going to get you there.
Right.
I mean, look at what we're hearing about the behavioral health issues. And one might argue that some of the digitization and the lack of personalization has contributed to these feelings of isolation and being alone, and the kind of mental health dissociation that people are experiencing from just the ability to interact with others. So this is a very complex environment. I think there is a tremendous amount that investment in digital is going to assist with, not only for consumers, but helping us, as I mentioned, we've started to gather a lot of data that's going to help us make a difference. And people have heard me say, when they say, what's the future of healthcare? I think people are really going to differentiate themselves on what they're able to do with the data they now have. Can you make a difference? Can you capitalize on Liat's preferences? How do you want to be interacted with? Mm-hmm. Like maybe a virtual urgent care engagement is fine if you've got a headache, but if it's for symptoms of your fibromyalgia, you really want to talk to Stacy, and she's like right. a virtual nurse that's part of your care team. And right. so we've got to allow that data we're collecting, whether it's preferences, whether it's your clinical condition, whether it's therapeutics, start to inform and differentiate how to get better outcomes and how to create different relationships with people who are counting on us for their care.
Let's get into a bit about what LifeBridge Health is doing today when it comes to digital patient engagement, and what are you seeing from patients that is driving some of your thinking today?
So we've been on this journey, as I mentioned, for a couple of years. I'm a frameworks person, so we started with really an assessment about where were we and what was going on in the market that was reasonable. We're a mid-market health system, as you mentioned, so we've got to be very principled about where we're going to make our investments to make a difference. I envy a bit, but that's not my role, the organizations that have a lot of discovery dollars where they can invest to see what sticks from a research perspective. We're a little bit more in that consensus model. And, I think what that exercise showed us is that, at least putting our toe in the water here, and this, is that our first foray has got to have successes and, frankly, in some regard, pay for itself. So we really threw quite a bit behind this idea that we have data to prove that we have all kinds of barriers to access. Traditional American healthcare does not make it easy. You're put on hold, you're transferred around, you're given a site of care that's way inconvenient for your lifestyle, et cetera, et cetera, et cetera. So we started with that access end of the funnel. And although we've made some investments in digital tools to help people on their care journey, really the last 2 years have been optimizing search to schedule, giving choice, and really making sure that access to appropriate care isn't the reason that you don't get it. So I know that sounds super simplistic, but it's been a whole combination of ratings and reviews, digital present, having parity between our digital presence and our web presence, having a LifeBridge app that enhances search to schedule. It sounds easy, but
Michael mentioned that you have call centers offshore, which is very unique in the healthcare space. So tell us also about that.
Yeah, sure. Well, listen, we believe that you can't just put into place a set of digital tools and they'll take care of themselves. And I think that's where a lot of digital companies, they have finally come to that realization. So many that just sold a digital widget now knows they've also got to sell the human program behind it. Because if you've got someone on a digital journey, that's just like dialing anyone and needing that customer service out option, right? So if you're on a digital journey and your care condition escalates so that you need an immediate virtual appointment, and or you need a handoffs to a specialist very quickly. Again, we are not enabling or reducing the barriers and access to care if it just stops there. If you've got a digital tool that answers 3 questions, but there's no one behind the scenes really capitalizing on how do I make that experience different and how do I advance their care, then you've got a problem. And to your point, we have a digital care center that does some direct patient care experiences, and we have 2 sets of offshore, but we also have in US because of the Medicare reimbursement restrictions. We've got to have folks with specific credentials. That creates some barriers, but it allows us also to monitor many, many more people on a digital journey and only intervene when they want us to intervene, as opposed to traditional healthcare today, where the consumer or the patient is almost brute force trying to beat their way into getting an appointment or getting care that fits into their work schedule or their personal life or that they can even afford.
Now let's get back to the challenges, because we touched upon that a bit. But when you are pushing along these digital projects, challenges you come across and how healthcare executives can learn from how you handle them.
I think one of the challenges, Liat, as I mentioned before, is right now we can't assume digital literacy. And, we've got to meet people where they are. And we're still at this cultural inflection point where for many people, either by choice or by digital literacy issues, digital is not going to be a channel that they're comfortable with. And so we, as a healthcare organization, have to keep funding the ways we used to do it and trying to find dollars to fund a new way of doing it, knowing that over time, we're probably going to see a much higher degree of literacy and comfort on accessing digital tools where it makes sense, right? Doing all that paperwork before you ever get in the door. I mean, I think you and I can relate to the fact that, yeah, if I know I've got an appointment in a couple weeks, I don't want to sit in your waiting room and be screwing around with that. Let me do it now. I'll get it all over and done with. The challenge in traditional healthcare, especially with aging population and where we are, is we still have a high percentage of our constituents, of our patients, of our community that aren't going to want to make that choice. They might make the choice that they want someone on their family care team to help them, and digital can help in that regard. But if they want to do it themselves and their only comfort is the way they knew they always did it, which was to show up, we've got to cater to that. We can't shut down that faucet. So now we're faced with funding and sourcing the way we've always done it, with trying to find dollars to transform ourselves for the new generation. So I would say that's probably one of the biggest barriers. We can't displace money that we're spending elsewhere for discovery here. Does that make sense?
Of course.
And by the way, it's not just the patients. We all heard how telehealth had this huge blossoming volume because it wasn't about the tech during COVID. And I don't want this to sound critical because I don't mean it to. It's not just because patients were scared for their own personal health. So were our providers. Mm-hmm. And now that our providers maybe aren't as fearful, many of them are falling back to the care in the traditional method they delivered. And they're saying, yeah, that helped when I didn't want to expose myself or my staff and I wanted to be there for my patients. But that same threat doesn't exist, and it's just more convenient for me to have them come in.
Right.
But guess what? That's not convenient necessarily for that patient. It creates a barrier potentially to care. So we've got to keep pushing on that.
That is an art of balance. I mean, kudos to you for managing that. Tressa, we're going to be moving on to a fun game now.
Okay.
It's time to place your digital bets. I'm going to be naming a technology in healthcare, and you're going to tell me if it's bullish or bearish, in your opinion.
Okay. And then I can tell you why I think that?
Please do.
Okay.
Number 1, telehealth.
Bullish.
Why?
Why? There are so many untapped opportunities in telehealth. We've got a lot of reimbursement issues and we have a lot of regulatory issues, but we have a workforce shortage. And if someone needs access to a specialist, they ought to have it. I would encourage any of you to read a recent article by Harvard Business Review that talks about what Kaiser Permanente and Intermountain Health have been able to do. And there are so many use cases that we haven't yet explored, again, where clinically appropriate. We know we've got a workforce shortage and we have these experts. Technology can bring them to the bedside. We've just got to get all the administrivia out of the way.
I love that. Technology can bring them to the bedside. I love that. I'm going to write that one down.
Okay.
Number 2.
I'm sure I stole it from someone.
Number 2, wearables.
Bullish, but for a whole different reason. So I love the health conscious nature of what we're seeing in the current generation.
Same.
Because they're taking control and they want to take control of their own environment. I think we see a lot of folks with chronic conditions and they have a victim mantle on and they're expecting the healthcare system to come up with this miracle cure for them when the reality is managing their own health has a lot to do with their own compliance and being invested in it. I think wearables, and we're doing some work here to get the wearable information face up in our EMR so that there can be that discussion about, wow, you had so many steps in the last week. We're still struggling with obesity. Should we be looking at diet? You and I know that the EMR is looking at 20%, just the clinical things that go on with us. There's so much more in our life, whether it's what's going on socially, but wearables are going to help give a lot of insight into our day-to-day lifestyle. And at the end of the day, it's our day-to-day lifestyle much more than these little connection points that we have with the healthcare system that are going to translate into our wellness over time.
Absolutely. It's all preventative, actually.
They are enrolling people in their own wellness. And we've never done that before. We thought, well, that's just a gym membership. So, it's so interactive. And, well, let me just stop there. I don't think I'm interested to see if you come up with any technologies that I give a thumbs down on. I think it's more what's its position and where do we place it? Now, finding ways to pay for it is a whole nother conversation, Leah, but go ahead. What's the next one?
Conversational AI.
Oh, big time. So we're really early in the journey. And to me, it's just like digital health. And what do I mean by that? Where there are repeat iterations of something, using automation is more cost effective than using people. If I can get something answered right and quicker, I actually don't care who's doing that for me. Now, it's a problem when it's wrong and slower, right? But rather than being handed over call person to call person, if it can be done efficiently and quicker, I'm all about it, number one. Number two, in the seat I sit in, I've got to figure out ways and technologies like conversational AI that allows me to take that away from a more expensive resource. I've got to find funding for the future. I've got to find dollars for my digital journey, and I'm going to do that over time by not having people do that, just like remote process automation, right? Or robotic process automation. I want something that's routine, that's non-value added, that is doable through automation to be done by automation. So when we get into that circumstance where we really need someone through cognition is having to contribute to that problem solving, we've got the person available to do that instead of having them do these routine tasks that they aren't motivated by. And frankly, that typically doesn't translate into a happy interaction. It's liberating people. We use in the healthcare industry this term top of license. I don't know any human that loves to do the exact same thing all the time. That's why assembly lines and machines came about. And that's not a critical comment. That's a positive comment. We've redesigned the work and applied technology where appropriate to get a higher quality, quicker outcome and make these other resources available for those more complex problems to be solved.
Number 4, remote patient monitoring.
All right. Well, this one's a
I know
tough
I'd get you. I know I'd get you.
Yeah. So I'm going to say I'm neutral on this. And the reason I say this is because we haven't cracked the code on it. What do I mean by that? I'm bullish on wearables. And I think as wearables become like, I'm going to be direct, and yeah, I don't know if I can disclose this. I was at Apple last week, and they couldn't really disclose it. But we think about people using smartphones or wearables, and we think about things like earbuds. All right, have something that, at least in America, most Americans have comfort with and pop in their ear. How do we take advantage of that as a physiological device, as opposed to sending them kits or expecting them to figure something out on their digital, or excuse me, their wireless network at home? And we have had a remote patient monitoring in place now for 4 or 5 years. It works really well, Liat. However, many of them have a lot of noise. They throw a lot of false positives, and it is very, very expensive for people like my team, a group of clinicians, to continually monitor the noise. What do I mean by that? You've got to be monitoring and escalating 7x24 by 365, and it's got to be honed so tightly that your care providers are only acting on signal and not just all the false positives. So I think we have a lot of work to do there. I think that the technology is evolving. It's getting easier. The challenge is the financial model. The health system typically has to pay for the monitoring tools, the wraparound people service, etc. And at the end of the day, it's really hard to demonstrate that the investments made added to a better health outcome. So we just haven't seen this scale for our chronic disease programs. Do I think it's going to happen? Yes. I do think that there are some things that need to happen between this confluence of medical devices being unique and proprietary. And by the way, there's a lot of noise even in the industry because, people are solving for diabetes, but not CHF. And a lot of patients, they have all these things. They have obesity and asthma.
Right.
So they're sent 3 different health kits and monitored by 4 different people. I don't think we figured this out yet, and I will leave it at that. So I am cautiously optimistic. I think we've learned a lot from what we've done, and I think the code on this has yet to be cracked.
This is my favorite part. I like to do a let's get personal, because Michael told me, and everyone knows, that you are very adored in the industry. You have colleagues that follow you everywhere you go. They admire you. So when it comes to leadership, what can other healthcare executives or just executives in general learn? What is it that you're doing well, in your modest opinion?
Well, I think it's an evolution. I think at some point every leader has got to understand where in their career journey they are completely willing to give up being the smartest person in the room and find joy in bringing all those other smart people to the table. Diversification of thought doesn't come from a single individual. So I think liberating the diversity, the intellectual capability, and the team celebration for wins is so key. And I think there are a lot of different techniques to do that. Personally, I spend a lot of time in skip levels. I make myself available. I hear from the people who work directly for me all the time, but doing rounds on a patient care unit to hear them grumbling about the impediment that the technology is creating, or having one-on-one sessions with brand new staff to really know them and hear them and understand what motivates them, isn't just inspirational for me. It helps me understand how we can advance what they're trying to accomplish in their career. It's liberating the power of my entire organization. And the only way I can do that is to make sure I'm getting barriers out of their way. And again, I think sadly it comes down to really leading from the back. When you lead from the front, there's usually not enough focus or attention left for the people that you're leading. And yet, really good leaders understand that the outcome of our work is never because of a single individual. Neil Meltzer, who's our CEO, he is a public health expert before he started running a complex health system. And, one of his favorite expressions is, if you want to go fast, go alone. And if you want to go far, go together. And as a leader, you got to bring people along. You can't motivate them to come along if you don't know what interests them, what they can contribute, and have them understand what their line of sight is that makes a difference. For us at LifeBridge Health every day, my information technology professionals, my digital care center professionals, my HIM professionals, it's critical to me in a mid-market size healthcare system that they have a direct line of sight as to how what they do every day makes a difference to that doctor's day, that nurse's day, that patient's day, and they can actually articulate it. That's my job as a leader, to make sure that people are enrolled. I think one of the biggest problems to be solved there is that there are a lot of people that'll join an organization on the technology side, and they can't align with the purpose of the organization. And I got to tell you, I don't care how talented they are, if they can't enroll with what we're trying to do for our community, it's just not going to work.
Yep.
There's a misalignment, and I have no anger for those individuals, but I'm really, we've really worked hard to find those people who personally can go home. Not every day is a great day, but most days they can go home and they can actually explain to people how they made a difference in the community that we're taking care of at LifeBridge Health. And to them, that's purposeful, meaningful work. And to me as a leader, every day I come to work trying to figure out how to liberate that for them.
You teach at Chime, and my question is, you walk into a room of 100 CIOs and digital healthcare executives that are entering the healthcare space today. What's one thing you want to leave them with to keep in mind?
They're going to make mistakes. They're going to make mistakes, and they need to understand that, and this is more of Chime mission, Liat, but having a network of people who represent a safe space for you to bounce ideas off of, or to share accomplishments or even failures, is invaluable. I mean, honestly, it can get really lonely when your own organization expects you to have the easy button and there isn't one. We can enlist is sharing best practices, but as importantly, creating that network of professional peers where people aren't competing for who's doing it best, but we're collaborating so we can bring the whole industry forward. That's really what I hope they leave with. Because stakes in the game. They're bright people. They're very decorated in their own regard. That's how they got to the chair they were in. Now they've just got to hopefully open their mind that in order to get to that next level, it's not about you anymore. It's about tapping into the power of us.
We spoke a lot, and I could honestly go on for 2 hours, but I'm sure you have a busy day ahead. Tressa, thank you so much again. This has been amazing and thought-provoking and deep, and I'm sure many people are going to enjoy this episode. Thank you for listening to Patient Journey Pioneers, brought to you by Hyro. Subscribe to our podcast on your favorite listening platform. See you on our next episode.